Hi, Vikram. So today's topic we are going to talk about is Barodontalgia. So in this format, it's an introduction, definition, etiology, classification, diagnosis, management, and the conclusion. Let's see the introduction. Barodontalgia refers to the that can be experienced during air travel or deep sea dive. It was reported first during Second World War and was termed then as aerodontalgia. This is an attempt to have a bird's eye view of the condition. This results from environmental pressure changes previously described as thermal culture. Incidence is more when the cockpit is not pressurized. It is very frequent among deep sea divers, marine biologists, and scuba divers. Baropressure pressure pain affects air crew and passengers, and also underwater divers, mainly due to difference in the pressure gradients. What is Boyle's law statement? Boyle's law states that at a given temperature, the volume of the gas is inversely proportional to the ambient pressure, may be used to explain barodynamics. Let's see the etiology. As atmospheric pressure decreases during acid flow, trapped gases may expand and enter ventricles, which can stimulate nociceptors in the pulp or cause the movement of pulp chamber contents through the apex of the tube, thereby causing pain. Same law applies to the person who climbs to high altitudes. In this case, outside pressure decreases, permitting the volume of gases to increase. As a person descends deeper and deeper below the water surface, the pressure exerted on the diver by the water increases and reduces the volume of gases in enclosed spaces such as teeth and sinuses. A problem arises when the enclosed spaces containing gas cannot expand or contract to adjust the internal pressure to correspond to the outside pressure. Possible condition, acute or chronic periodic condition, caries, deep restorations, dental cysts, sinusitis, ministry of very recent surgery. Incidence is more in possibility. Vaccinated team are more affected than the mandibular tooth. More incidents is about reported in the restored tooth. Effect of parodontalgia. Full porcelain crowns can also shatter from relatively shallow dives of 65 feet. It is reported that the trap hair is a very efficient crown remover in deep that the cement bond is fatal. Classification. The FDA has classified parodontalgia into four groups according to its sign and symptoms: acute pulpitis, chronic pulpitis, necrosis of the pulp, and periapical abscess or a cyst. The Rogers classification is based on teaching company, where the class 1 is for patient that is pulpitis, severe pain or upset, sharp penetrating pain of acute pulpitis. Class 2, dull throbbing pain, case of chronic pulpitis. Class 3, if the pulp is necrotic, a dull throbbing pain on descent and asymptomatic on ascent. In case of periradicular abscess or cyst, severe persistent pain occurs with both ascent and descent. Barodontalgia and scuba diving. In deep sea divers, the physical property of the gas mixture used during deep sea diving may contribute to barodontalgia. In scuba tanks, oxygen's natural diluent gas, nitrogen, is replaced by helium, resulting in a gas of lower viscosity. This can enter tissues, including teeth, that sometimes become trapped in closed spaces such as bulb chamber and the bronchial. These two mechanisms by which gases can be trapped in spaces. If there is a space between a tooth and its restoration, gas may be forced into it during an increase in pressure. This all gas may diffuse from tissues to spaces as pressure decreases. Odontocraxis refers to physical disruption of tooth during diving, descent, or descent. This is due to trapped gas which will expand and result in stress causing tooth fracture. Teeth may have been opened for endodontic treatment and temporary seal have been known to explode from air trapping and expansion on surface. This is found to be more common in deep divers using a Helios friction. Barodontalgia and microleakage. Lions and co-workers compared types of students and the role in barodontalgia. The results showed that microleakage was greater in cast crowns that were luted with zinc phosphate followed by glass ionomous sweat, and least was observed in resistance. It is thought that porosities that occur during mixing of zinc phosphate and glass ionomous sweat could be responsible for microleakage. These porosities may contract or expand along with pressure changes. They further suggest that microleakage may not have occurred in the original skin fluid because the dentinal tubules were obstructed by the syntax and flexibility of the skin. Barodontalgia was barosinusitis. Barosinusitis is a distinguishable form of barodontalgia, as the former will always occur on descent, whereas the latter always begins on ascent. Management. The placement of zinc oxide original based cement was found to prevent barodontalgia when reversible pulpitis was the underlying cause. This is attributed to the well-known sedative techniques of Zidane. Another study suggested that the treating people was related to large pressure changes. It is best to avoid procedures such as pulpectomy and capping of an exposed balloon, rather than endodontic treatment is indicated. Conclusion. To sum up, the present day dental clinician should be in a position to diagnose and treat situations which require interventions, especially for those who are very regular taking a flight or those are into deep sea diving sports. Thank you.